All right, back here now at the KFYR Plus news desk. And obesity is a disease that can impact your overall health and quality of life and lead to serious medical conditions. Now, in America, 2 out of 5 adults are obese. Doctors have been prescribing now weight loss drugs like GLP-1s to help tackle this obesity epidemic. But those drugs can be very costly, and limited insurance coverage forces many patients towards unsafe alternatives. Joining us now is Dr. Angela Fitch, past president of the Obesity Medicine Association, to talk about the concerns with these unsafe alternatives. Dr. Fitch, thank you for your time today.
Jay, thank you so much for having me.
You bet. So let's jump into it. What specific dangers do patients face when using compounded versions of the GLP-1 drugs like semaglutide or tirzepatide?
Good job. Those are hard words to pronounce.
Yes, they are.
So this is the issue. I know this is the issue is that, these compounded versions are not FDA approved like the original versions that were researched and created over decades by the pharmaceutical companies that made them. So the compounded versions are knockoff versions, and we're very concerned as medical societies across the country that patients are not getting something that's safe, effective, or of high quality. And when you're taking something, for a disease in which it also puts you at health risk, it's not a good situation.
Yeah, why is insurance coverage such a critical factor in obesity treatment?
Well, for decades, people with obesity have been stigmatized and marginalized and not have good coverage or good access to treatment for obesity because there was this stigma that obesity should just be treated by lifestyle intervention alone. When we know that many of our chronic diseases have lifestyle components, there are things we do to prevent cancer, there are things we do to treat our hypertension, there are things we do to treat, our blood sugar or diabetes that are related to our lifestyle. But we also use medication and surgery and procedures, to treat these chronic diseases because we know that that creates a better outcome. And for decades, people with obesity haven't had that same coverage as a chronic disease as other chronic diseases have.
And of course, lack of coverage then pushes patients towards some unsafe alternatives.
Well, yes, and there are people taking advantage of that because there are, over 140 million Americans in the United States that qualify and aren't getting access to this care like they should, in a chronic disease fashion, covered by their insurance. And so we're really fighting to hopefully, with the movement that we saw last week with Medicare now being able to cover these medications for these GLP-1 medications next year for certain patients, with obesity and overweight conditions, then, it's hopefully going to open the doors for more Americans to have coverage as well so that they don't have to resort to risky, unapproved, compounded versions.
Yes, should regulators curb the rise of these unsafe compounds or let the market deal with it?
Well, we as physicians believe that we should do something to stop the large scale compounding. Compounding is a valid option for patients when they, for example, might be allergic to something in the medication. So a compounding pharmacist locally would make a version for them that doesn't have that preservative or whatever the patient might be allergic to. So it plays a special role in our healthcare system for sure. But this mass compounding and adding things to it like B12 just to get around the vitamin B12, just to get around the patent is not what we think is safe or effective because we don't know what happens when you mix semaglutide and or tirzepatide with B12. We don't know what happens when it sits on the shelf. It could create things that are unsafe for us. So that's what we really want to get across to patients is, talk to your doctor, get a safe, effective treatment for your obesity, and don't settle for less.
Yeah, that was going to be my next question. What steps can patients take to ensure that they're getting safe, approved treatments?
Well, most importantly is to work with a clinician who you're going to be able to work with in the long run. A lot of these offerings come with very short-term fixes that are posted as short-term fixes that you're going to get access to. And really, you want to talk to your primary care doctor or talk to an obesity medicine physician that you can, form a relationship with over time and get ongoing care for this because it's not a short-term fix. It's something that you have to invest in the long run.
And what are your thoughts of President Trump aligning with Eli Lilly and Novo Nordisk last week?
Well, I think the fact that the administration and the pharmaceutical companies are working together, I think, is a good thing in order to lower the prices of these medications. We've been trying to work on that for quite some time in terms of getting Medicare to cover these medications. That was what was really critical, is that because Medicare didn't cover these treatment options, they weren't covered by the rest of commercial insurance plans. So obesity as a disease is carved out over in an optional category when it's affecting, over 40% of America. And so we really feel like it shouldn't be an optional thing. It should be something that people have access to. And the more we can all work together, payers, employers, citizens of the United States work together to try to, get more people access to treatment. That's what we're really trying to focus on.
Is there a danger that patients could just become reliable on this and not adjust their diet?
Well, that is really a form of the stigma and bias that's occurred over decades. We know from many chronic diseases, as I mentioned, that there are lifestyle components to those diseases, but we don't only treat them with lifestyle. Imagine, going to your cancer doctor and telling you that we're just going to treat your cancer with lifestyle. No, we've developed treatment options. Science has advanced to develop medications and surgeries and procedures in order to advance not only our lifespan, but our health span. How healthy we are during that journey matters. And how we're going to get healthier is by having a comprehensive approach to our treatment, not just a one size fits all and not just a one treatment here, one treatment there, but really bringing it all together. And that's where we're going to see the most outcome from treating this disease.
And Dr. Fitch, where can viewers go for reliable information on obesity treatment and safe medications?
Yeah, the Obesity Action Coalition is our nonprofit arm that focuses on patient advocacy as well as access for patients. And that's the www.obesityaction.org. And they can go there and they can find out about safe and effective treatment options, as well as all the advocacy that's being done at the state and national levels in order to really advance the care of patients, of people living with the disease of obesity.
And Doctor, thank you so much for your insight today. Very valuable stuff.
Thanks for having me.
You bet. All right, 5 minutes outside of the top of the hour. Quick break here at the news desk. We're right back here on KFYR Plus.